Do you struggle with pain and discomfort through your neck? It may be a disc injury, it may be a facet strain, it may be muscle tightness, or you may never have got it formally diagnosed by a health professional. If you do and you're an office worker, there's every chance that something that you're doing while you're sitting at your desk is the cause of this neck complaint. Now, the neck complaint that you experience may not occur while you're sitting at the desk. You might notice it when you're lying in bed at night. You might notice it when you do a deadlift at the gym. You might notice it when you try and do a head check in the car. Pain and discomfort that you experience through your neck that occurs outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor, static postures. And where do we do most of those? At work, of course. It's really important to consider the ergonomic, the postural, and the behavioural things that you do every single workday that may be contributing to the health of your neck. It's really important that you use your body how it's designed to work, and issues in these sorts of areas can absolutely cause neck complaints. So let's have a bit more of a chat about the anatomy of your neck and talk about how it's designed to be used, and then talk about some of the problems that can be associated with chronic neck complaints in an office worker. Okay, let's talk about your neck anatomy and how it's designed to be used over the course of a 40-hour work week to minimize injury and discomfort. Your neck is basically the bridging structure between your skull and your shoulders. So it's a series of vertebrae that should all stack nicely on top of each other. When we sit nice and tall with our chest up and our head sitting squarely over your shoulders, the loading through each of those vertebrae should be perfectly flushed and balanced, and it should stack perfectly on top of each other. When you're in this position, it's a great position to be in because you don't actually need that much muscle input to maintain this positioning because the load of your head going through your neck is perfectly balanced. Where you run into trouble with neck complaints is when we deviate from this positioning. Some of the textbook positions are when we drop into our chin, which creates extreme extensions through our vertebra, or when we look off to a side for a prolonged period of time. Whenever you put your neck in these sorts of positions, what happens is you've changed the loading through these vertebrae and you've changed the position of gravity relative to those vertebrae. So what happens is if we, for instance, look off to a side for an excessive period of time, what happens is you put this rotational torsion through some vertebrae. And the body will do it, but it's not a stable position and it's not a great position for the neck to be in for any excessive periods of time. So what happens is the musculature within the neck will engage because what it's trying to do is it's trying to normalize that loading through the neck. So it's trying to take that rotational element out of the neck. Where you run into trouble is that you don't recognize that twist to the left for a long period of time is actually a bad thing. So we continue looking off to that side, and then you end up over recruiting the neck muscles, which are trying to normalize that loading, which can lead to compression and strain through your neck. If you do struggle with neck complaints, have a look at the positioning that you're in for a long period of time. Do you drop into the chin? Do you look off to a side? Because if you do any of these positions for a long period of time, that's when we end up in trouble because we're putting poor compressive loading through the neck. Necks like to be square and they like to be straight for most of the day. So if you can keep your chest up and you lengthen your spine and you put the nice even square loading through each of those vertebrae, most neck complaints will sort themselves out. The first consideration in terms of neck complaints is monitor height. As you can see, if you're looking down to a low monitor, you're putting a huge amount of forward flexion through your neck. Your head is heavy, and the further you look down, the heavier your neck becomes. It's really important that when you're considering your ergonomics and your desk setup, that your monitor height sits at eye level. When you sit up nice and tall and you look straight ahead, you should be looking into the top third of your screen. To raise the monitor up, you don't need to buy anything fancy. You can use a monitor stand, but you can also use reams of paper or books. The single biggest ergonomic cause of neck complaints is when we don't have our monitors squared. Generally speaking, if you've got more than one monitor, what people tend to do is they tend to put it off on a 45-degree angle. Often the excuse is that they don't use that monitor particularly regularly and they don't reference it that much. However, from our experience, you tend to use it more than you realize. And a classic neck presentation is when you have that monitor off on that 45-degree angle. When you look straight ahead, your eyes have the ability to track 15 degrees left to right. And when you're looking squarely at the monitor in front of you, it's a really passive position for your neck to be in. When you have something off at a 45-degree angle to look at, your eyes cannot track that distance. And so as a result, your neck has to rotate for you to reference that monitor on the left. This is where you run into trouble with neck complaints because that rotational element to the left for any excessive periods of time can really load up that neck poorly. It's really important that when you do have more than one monitor, that they're positioned directly in front of you and side by side. Laptop use and neck complaints go hand in hand. A laptop is a terrific piece of technology, however, it's only designed to be used for very short periods of time. An hour here or there, no problem at all. However, for the average full-time office worker who sits at a computer for 40 hours a week, if you do this on a laptop, I can almost guarantee you will have neck complaints. Have a look at the angle that my neck is in when I'm using this laptop. You can see how forward flex my head positioning is. And this is really a similar position to having your monitors too low. A laptop is able to be used under a certain series of parameters. You essentially need to always have it on a laptop stand, and it always needs to be centered directly in front of you. If this is the case, you will then need to get a secondary keyboard and mouse to allow you to use the laptop. And if you can use it in this parameter, then it's fine to be used over the course of a workday. Tech neck is a term that is thrown around pretty commonly these days, and it's a result of the way that we use our mobile phones. Generally speaking, we bring our heads down to our mobile phones. We rest our arms passively on our thighs or at our desk, and we look down to our mobile phones. The problem with this is very similar to laptop use and low monitor positioning, in that we've got this forward flexed head positioning. Think about how much time we spend on our mobiles and devices. And then think about how much work and effort it is for our necks to maintain this position every time we use that device. It's really important when you use a mobile phone or another device that you hold it up to your eyes rather than bring your eyes down to the phone. The single biggest cause of neck complaints from a postural perspective is the slouch posture. This is when we completely collapse into our chest and our rib cage and we really drop into that chin. You can see from this positioning like there's a real hinge point through that neck. See how extended my neck is in that position, and there's a real point where it's pivoting from. This positioning is terrible for your neck. It puts huge amounts of stress and strain through your discs, and it can lead to a lot of neck complaints. It's really important that when we sit tall. We need to lift our chest up and open up through our rib cage, and we need to lengthen our neck so that our head is sitting squarely over our shoulders. Anterior head carriage is a massive problem in terms of neck complaints. As you can see in this position, look how far forward my head is from my shoulders. It's miles ahead. Our ears are nowhere near over our shoulders. In this position relative to gravity, our head has become so much heavier, and as a result, our neck musculature has to work so hard to maintain this position relative to gravity. This positioning can be because our glasses script isn't up to date. It can also be a concentrating position. Despite these excuses, it doesn't help your neck. It's really important that you bring your head back over your shoulders. A slight variation of the slouch posture is when we simply just drop into our chin. It doesn't necessarily involve all of your torso in this positioning. It's more of a simple drop into your chin. It loads up the neck very similarly to the slouch posture in terms it puts our neck into quite an extended position. So just be mindful of making sure you elongate your neck and push the vertex of your head up to the sky. A behavioural consideration in terms of neck complaints is when we have a colleague or a doorway or a window or something that we regularly turn to over the course of the day, we end up just turning our neck rather than our whole body. As you can see, for me to maintain this very twisted neck position, there's a huge amount of strain and tension going through the musculature within my neck. It's a really hard position for my body to maintain for a long period of time. It's an extremely fatiguing position. It's really important if you do have something off to the side that you reference regularly, that you not only turn your neck, but you turn your whole body to face where your attention is drawn. And then when that is finished, that you square yourself back up to facing the desk. We touched on this earlier in terms of anterior head carriage. It's really important that if you do find that you're squinting or that your eyes are fatiguing, you A, wear your glasses that you've been prescribed, or B, go to the optometrist and get your eyes reviewed. The anterior head carriage that results from squinting can absolutely cause problems with your neck. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.